This is something that has frustrated me throughout all of my training. Why are we doing all these tests on patients? And the answer is always, we do it because we have to. And I've seen not just where it adds to delays, but where it's actually caused harm. And so one example that stands out is I had a young 13-year-old patient. She was non-English speaking, so being translated through the brother who was there with her. And she was there with a rash. And this was a classic example of Stevens-Johnson syndrome. And so trying to figure out why she had SJS. And it turns out that they had gone to a clinic and she complained of abdominal pain. And they diagnosed her with possible parasites in her stomach and gave her Bactrim. And Bactrim is known as one of those medications that is highly associated with SJS. And so it just did not make sense. Why would you put somebody on antibiotics for abdominal pain, for possible parasites, and why would you give Bactrim? And here she is with her skin sloughing off, as in to the extent of a third-degree burn. Her oral mucosa, her eye mucosa, conjunctiva were involved, and I had to transfer her out of the ER to a burn center. And so that's a classic example of where unnecessary use of antibiotics actually led to this poor girl having a life-threatening condition where she had to be admitted to a burn unit for burn level care. And so choosing wisely has really given me a definition and a very clear message and mission to align all those feelings that I had of frustration. It's been able to message it to colleagues, to peers, to patients.